Next up, we have Health Information Management, the undergraduate Health Information Management program. We have Dr. Dilhari De Almeida with us, and perhaps Dr. Valerie Watzlaw. I believe she's logging on at some point too.
Nicole, just to let you know, Val couldn't make it today. She had an appointment, so it'll be me and Lemon.
Oh, perfect. Well, you are definitely the go-to person for me when it comes to questions about health information management. So we're still in very good hands as far as the program goes. Now, let's see. Health information management. Before we begin, you have submitted a proposal to make a change to the HIM program to the university. And while this is not official yet, we haven't gotten any feedback that suggests it isn't going to happen. So would you mind telling us what that proposal is requesting and why you're making the change?
Sure. So, hi, everyone. My name is Dilhari De Almeida, and I'm a faculty member in the Department of HIM. So, starting last fall of 2020, we started infusing more of healthcare data science into our undergraduate curriculum. So, if you do a comparison of pre-fall of 2020 versus post-fall 2020, you'll see that we still kept the main components of health information management in there, but also added more data science, artificial intelligence, machine learning type of courses. And why we did that was actually probably multiple fold. We had our graduates going into fields that require these skills, and they really thought that they had a very good understanding of some of these skills already from our old program. Yet, with the movement of more artificial intelligence, machine learning, and data science, the advisory board and some of the advisors were suggesting that we should, with the enhancement of healthcare data science in our curriculum, the next step then was to change our program name from Health Information Management to Health Informatics. So that, as Nicole was mentioning, is a submitted proposal right now in the submitted phase. And hopefully we are coming here towards the end of an approval, fingers crossed. But that would be our new name, Health Informatics. We also have a graduate program in Health Informatics that you'll hear later on in our segment today. So it really is, we are one of the pioneers in the country for delivering health informatics at an undergraduate level, because there's not too many programs out there that provide this type of in-depth data science in healthcare, health informatics, data analytics, and health information management components. So your traditional HIM classes with healthcare privacy and security, medical coding, healthcare reimbursement, all of that is still part of our curriculum. So really, the students get to have a very complete picture of how healthcare is applied to IT and vice versa. So stay tuned for our new name.
If I remember correctly, I believe the program as it currently stands with the reformatted curriculum has the highest data science score. University is scoring how much data science information is in a given program. And I believe this program now has the highest score of all University of Pittsburgh programs.
That's correct. Yes, I'm glad that you brought that up. There is actually a data science task force of a group, if you will, at the university, and they reviewed all of the undergraduate programs, and our program came to be right at the top with the whole acumen of all of the different components that bring up part of data science, and we are the number one program that can provide a complete data science acumen, as they say.
So that is really exciting, especially in a time when data science is being integrated into every field. No matter what you're doing, you should probably know a little bit about data science if you're going to, be a functioning adult, as we move into the future of everything. So thank you for sharing that. Now, what types of students might be interested in health information management, health informatics type career?
Sure. So I think what distinguishes us from most of the other health professions related careers is that our profession does not have direct patient contact, right? So you are still in healthcare and providing a pivotal role in managing a patient's health, but you are doing so by managing the patient's information. So for example, maybe you are part of implementing the electronic health record, where all of the content about that patient's information is kept so that the clinician then can make that direct patient contact, right? So some of our students come to our program because, most of the students come to our program because they truly want to make a difference in healthcare, and they do have a passion for IT. So it's really that bridge that brings them, to us, because like I said before, you are not only learning about the healthcare specific courses, but you're also learning IT. You're learning the business aspect of healthcare. You're learning the revenue cycle aspect so that you know how physician officers and hospitals are billing you for a patient's encounter and how that bill gets dropped. So you're really learning how an entire healthcare system operates. So students who might be interested in that intersection between healthcare and IT, I think would be a great candidate for this program.
Thank you. Now, moving over into admissions, SHRS is updating general education requirements. So our upper division program prerequisites are changing a little bit, but not for fall 2022. Fall 2022 our current rising sophomores are going to still follow the old prerequisites. Reminder, we'll be sharing new admissions pages in early August that will showcase the difference between fall 2022 and 2023 admissions. Now, Dohari, what changes, if any, will we see to the HIM prerequisites moving into the new general education requirements?
So moving beyond 2022, I think we at this moment are not planning major changes for like the HIM specific requirements, but we do have, as part of our school, I believe we will be adding a course in diversity, a course in global health, that type of thing, because really I think we all understand and appreciate that our students coming into our school and our programs have a well-rounded understanding and appreciation of diversity, inclusion, and global healthcare in general. And like Nicole said, I would really alert you to, keep looking at our upcoming catalogs, if I may, is that the right word? I'm not sure, but, that we will be continually updating that on our websites.
And are there any opportunities for students to explore the field before they apply to the major?
Good question. Yes. So we try to, and I get that question, quite a bit from our students, and we try to match them to some of our preceptors, some of our project supervisors. And it might be, it may not be a huge, a multi-day experience. It might be a half-day shadowing experience, or it might be a virtual experience that they could do. But we try to see if there is a match that we can, we can have a student encounter, or we have a great research project multiple research projects in our department. So if a student might be interested in what research might be out there to do in health IT, in data science, health informatics, we try to see if there's a project for a pre-HIM student. And we also really encourage them to seek out any volunteering opportunities, as soon as they think that maybe they might be interested in health information, maybe even your local doctor's office, or go into the volunteering sites at major health IT companies or healthcare organizations. Most of them have a volunteer space that you can submit your application, and they can give you opportunities if the timing is right. Also, that being said, I think it is not required, but the only thing that we say, if you have a little bit of experience, is it might help. The only reason is you can encounter sort of how a health IT system might work in person, so that you can decide on if health information management is right for you. But certainly, we get students from multiple different backgrounds in their pre-HIM curriculum, as well as in students with no experience in healthcare at all, to students who might have a little bit of experience. So either way is fine, but I would encourage students to start volunteering in different organizations, and they can start early, and certainly reach out to us if they have any questions or interested in learning more.
There's also a Foundations of Health Informatics and Information Management course that is open to first year and sophomore students. It's available in the fall. That's another great way to not only get to know the field a little bit more, but get to know the program a little bit more before they submit that application in the spring term. And that's open to first years and sophomores. So any student could enroll in that course. Here's a quick look back at the last couple of years of HIM applications. Dohari, when you're reviewing those applications, what are you really looking for in the students that are ultimately admitted to the program?
So we do look at how they perform academically, in order to make sure that they can handle our curriculum. But in addition to that, we do pay attention to their personal statements, their essays, as well as letters of reference, because sometimes your GPA or your courses might not tell the whole story about you, right? There might be gaps, there might be instances, life can happen in between. So we do really read the letters and the essays, personal statements, and the letters of reference very, very thoroughly, in order to really look at a holistic view, of the applicant.
And I think that anyone who's joined us for more than one of these sessions has really heard over and over again how valuable all of our programs find those recommendation letters, and especially those personal statements, and really getting to know the students. And I think we did have one guest the first week who was surprised at how valuable those are and how important they are to that application process. So I just wanted to take a moment and reemphasize that those are such important pieces no matter which program you're applying for. So really encouraging students to put their best foot forward when putting those items together is so very important. Now, in I think it was the second slide we had, I mentioned that there are flexible career paths. And I think it might be worth noting that these aren't just flexible career paths from a bachelor's degree, they're also lucrative career paths from a bachelor's degree. So would you tell us a little bit about what students are doing after they graduate? Are they going into graduate studies? Are they going directly into the workforce?
Sure. So most of our graduates do go into, directly to work settings. So we are fortunate enough, and our profession has been growing, and all the stats from labor statistics and others show a really booming, path forward. So I think, will continue to grow, and really the infusion with healthcare data science in our curriculum, we see that growing even further. So most of our students, I would say probably, a good 90% or so do get job opportunities either before they graduate, so during their final semester in our program, or soon after they graduate. And in terms of what they find too are really, really amazing opportunities. So they go into, we might, and it's truly diverse, right? So we might see students going into data analytics. So it might be a systems analyst, a EHR implementation specialist. So if they are working with the electronic health record, there might be some students might work as consultants in, really great consulting firms like Ernst & Young, or there is different EHR implementation consultation organizations. They go into, so that area, some go into, we have rotational programs that some organizations have, which is very competitive to get into. And you get to rotate through about 4 different areas within the organization before you may then join a permanent appointment with them. And then some, we do have, I would say, probably anywhere between like 2 to 5% of students who go directly into graduate school as well. Some come into our graduate program, some go into different programs. So we really have a truly diverse setting in terms of, work opportunities. Some go into policy, some go into health law. I had students who are so interested in health law. One of my students right now is in law school, completing her law degree after our degree. So our degree, I think, gives you a nice stepping stone to any other health career that you may be interested as well. So
it really does provide such an interesting foundation. No matter what direction you step into, you could step into a clinical graduate program with a little extra understanding of the administrative side of things. Boy, won't that set you up for a promotion down the line, whether it's a law school or working in industry. I believe you have an alumni with that's working with Amazon, and some of the health areas that they are trying to step into, or they are succeeding in stepping into. So there's just so much opportunity from this undergraduate program in particular. Mm-hmm. Now, do the advisors have any questions for Dilhari before we move on to the master's degree? Thanks for joining us this afternoon, Dilhari. We really appreciate your time and your insights into the health information management, hopefully soon to be health informatics undergraduate degree with SHRS.
Thanks. Thank you. See you. Okay. Bye.
Bye-bye.